This topic is a topic that we all need in some shape or form. And I am so happy to have with us Dr. Christina Wilson.
Well, first of all, thank you for having me. And I am so happy to be here. And I am thankful to have found such a wonderful organization to partner with and share a little bit about sexuality and cancer, which is something I'm very passionate because of my background in oncology and working with patients and survivors just like yourselves. And that it is stories from patients like you that led me to go into this research as well as practice. And so I am faculty at the School of Nursing, and I do research on sexual health and gynecologic cancer. And I also treat women or treat patients rather with gynecologic cancer and breast cancer at the University of Alabama O'Neill Cancer Center. And so I wanted to talk to you a little bit about sexuality, cancer, and relationships. And so first I have just a little outline. We're gonna go over the purpose and objectives of today, a definition of sexuality for this discussion, what I typically define sexuality as, which is very broad. And then an overview of how cervical cancer and its treatments can alter one's sexuality, which I'm sure all of you have a decent knowledge of, but I just wanted to give a brief overview. And then we're going to talk a little bit about redefining yourself after your diagnosis or treatment, as well as redefining your intimate relationships. And so I hope that you'll be able to take away information on how cancer can change one's sexuality, ways you can redefine yourself as well as your relationships. And so first I kind of wanted to go into a definition of sexuality. So it's more than just the ability to engage in sexual activities. It includes your body image. It includes the level of femininity you feel about yourself. It includes reproduction, and it does include sexual function. It's related to your personality. It's related to who you are as a being. It is part of your essence, part of who you are. And it has psychosocial, emotional, it brings in your culture and your background, and it can change over time. If you think about your sexuality as a teenager to young adulthood to middle adulthood to older adulthood, or from experiences where with college or with cancer or with major illness or whatever it may be, it can change over time. And it's very fluid and does change over time. So in essence, you define who you are. And that is what I really want to center this around is cancer and cervical cancer are one thing, but they aren't all of you. So we're going to talk a little bit about cervical cancer itself. So cervical cancer itself can change how you feel about yourself. It can change how you perceive yourself. It can be related to the bloating. It can be related to the bleeding. It can press on the nerves in and around the area, causing sexual pain. It can also cause pain in general, leading to some of those emotional changes about yourself. The bleeding and pain can cause a lack of intimacy. These things can prevent reproduction if that's something that you're interested in. And it can lead to changes in your mood, emotion, and the cancer itself can alter sexual activity. Now, the treatments themselves each have impacts on body image issues, hormonal changes, loss of reproduction, psychosocial, emotional, and alterations in anatomy. For example, surgery, you're going to have potentially you'll have your cervix and your uterus removed, but you may also have your ovaries removed, which is going to lead to hormonal changes. It leads to body image changes. It can lead to alteration in bladder function because your uterus held up your bladder. And so now you may have issues with incontinence or frequency or urgency to go. That surgery can alter reproduction because your uterus is moved. It can have a psychosocial effect on a feeling of loss, that you've lost something that was yours. Chemotherapy, it can suppress hormones. If you didn't have surgery, it can suppress your hormones, which can change intimacy. It can change the makeup of your body. For example, body image changes of hair loss, things like that. It can lead to loss of reproduction via hormone suppression. It also has psychosocial and emotional issues with it as well. And we know that chemotherapy can lead to depression as well as anxiety, and that those treatments sometimes can lead to fear because if you've had a bad experience with nausea or something like that. And radiation can have issues on all these as well. You can have radiation changes. For example, if you didn't receive surgery, they can suppress the ovaries. They can lead to body image changes in the fact that the radiation itself could, if it's external radiation, it could lead to redness and radiation, what we call burns or radiation. It's like a sunburn, but worse from radiation. It can cause scarring and fibrosis in the vagina, which alters the anatomy. It can cause scarring inside and adhesions or these thick scar tissue that can change the anatomy. And itself, going through intravaginal radiation can lead to psychosocial emotional issues because of the fact that you have to have something placed internally for a period of time. So I really want to talk about redefining yourself. And this is what I alluded to before. So first, before we get started, you have or you had cervical cancer. It doesn't define you. It is one thing about you. It's not everything about you. I'm a nurse, but being a nurse doesn't define me. It's a part of me or a piece of me. So I want you to, when you're thinking about defining yourself or redefining yourself, I really love this picture because it's a blank slate and you are a blank slate. You determine who you are. And so take inventory of yourself, assess who you are now. You can assess what things have changed, what things haven't. And take inventory of yourself. I want you to set realistic expectations about things. So if you have weight loss or you have weight gain from your treatments, set realistic expectations on those. If you have a scar that you want healing on, set realistic expectations on how that's going to happen. These things are going to happen on your own time. They're going to happen periodically and they're going to take time to process through, but there are ways to process through these changes, whether it's an impact on your body image, whether it's an impact on your sexuality, whether it's an impact on your loss of reproduction, the level of femininity you feel, whatever that may be. Set expectations, but know that it is a gradual process. And talk to your clinicians. I cannot say this enough. Talk to us. Tell us that you're experiencing these things. Tell us that you're having changes in these things. And allow us to help you through this process. So when you think about rediscovering yourself, there is some literature out there talking about ways that you can potentially improve some of these aspects. So for example, if you feel like your body image has really been altered, and when I say body image, I talk about the way you perceive yourself, because the way you perceive yourself is number one. And then you can think about how others perceive you, because if you aren't happy with who you are, you're not going to see yourself through the light that others see you. And so, for example, yoga and art therapy have actually been shown to help patients improve their body image and perhaps see who they are and define who they are after a significant event. In terms of sexual function, and I know I'm going to bring up the dilator, but continued dilator use is important. Whether or not you are interested in a partner, whether or not you are interested in sexual function activities, it is going to help you rediscover you and rediscover you after cancer, because it's going to allow your care providers to determine if there's a recurrence. And if we can determine if there's a recurrence, we can stop that early, and either through surgery, through chemo, through whatever means it may be, to get rid of the cancer that may have come back, which is going to lead to a lessening of experiencing all these things again. Another thing is, if you aren't happy with your sexual function, or you are irritated by the way that your vagina feels, or your pelvic area, daily moisturizers and lubricants are absolutely evidence-based. So the box may say moisturizer used 2 to 3 times a week. You can use it 5 times a week, and you can buy them over the counter. Lubricants as well. Techniques to improve psychosocial or emotional aspects of sexuality. Psychosexual counseling, as well as individual counseling with any type of licensed professional counselor or psychologist, has been shown. It does not have to be a sexual therapist to make improvements in sexuality. And then journaling. They've also shown that studies on patients journaling has helped them process through their experience and in rediscovering themselves and identifying who they are again. Some additional thoughts. I want you to think about things you did and you enjoyed before your diagnosis, or things that, so think about things you enjoy or things you did enjoy prior to diagnosis. Do these things define you, or are they a piece of you? I'm getting back to that. It's a part of you. It's not all of you, because all of you are the people that are sitting in front of me. It's not just a diagnosis or an illness. And my other thing is, do you still do these things? Do you want to? Or is there some? So go back to the things that you love. If you didn't love them, explore something new. It will help you potentially dive into something, find something new. And I know with COVID, it's a little bit difficult with trying new things to be safe, but try something new and see if you like it. There are online cooking classes. There are online yoga classes. There's all sorts of things that you could potentially try or explore. Then I want to talk about redefining intimate relationships. And so whether or not you have a current partner, or if you potentially are looking for a new partner sometime in the future, I just want you to think through some of these things that may be helpful. So if you have a current partner and they have gone through your cancer experience too, they've had an impact on them as well. And so it's important to discuss and open up about those things. And through that, you want to normalize each other's feelings and explore those feelings to help understand how it's impacted both of you. And if you're in a new relationship, you want to also talk about cancer's impact on you. And you want to set expectations in terms of, for both current or potential new partners. You want to set expectations. You want to revisit intimacy and sexual activity. And through that, that's what I set set expectations. You want to develop a timeline, talk about a timeline, talk about when and what things might progress. You want to normalize affection. So affection comes in many ways. It's not just sexual activities. There's hugging, there's kissing, there's cuddling, there's all these other aspects of intimacy, and you want to normalize aspects of affection that that you can, and create that on your timeline as part of redefining your relationships and intimacy. And again, talk to your clinicians, talk to us. There are things that we can do related to intimacy, related to redefining yourself, relationships, sexual function itself. So when I talk about sexual functioning, there is a whole lot. And so sexuality, part of that is sexual functioning. And sexual functioning includes desire, arousal, lubrication, satisfaction or orgasm, as well as pain. And so there are all 5 of these things, and there are things we can do for all of them. Granted, some things we can do for some are limited in some areas, but there are things that are highly known to be effective in other areas of sexual function. And so knowing that there are abilities to help with this, and knowing that, so one, talk to your gynecologic oncologist, tell them if you're experiencing these things. Know that depending upon where you are, either your cancer center or potentially a cancer center that's not so far away, perhaps regional, has a sexual health and cancer program and or clinic. And that has experts in it that actually understand the cancer itself and the treatments you've undergone, as well as the impact on your sexual health. And that's something that I treat myself for patients, is because I worked as an oncology nurse and I am a women's health nurse practitioner, and I've combined both of these into an area that I understand quite well, and they exist throughout the country, but they aren't as well known as supportive care clinics. And so knowing about these things is crucial, and knowing that you can talk to clinicians, because it shows that many patients experience sexual dysfunction, but very little communicate. And those barriers include discomfort with your clinician, you don't know whether or not it's appropriate, you don't know whether it's normal. Well, your clinicians have those same barriers. They are worried to bring it up with you. They don't necessarily know all of the available treatments. They may not know what's going on and whether or not you have that desire to bring up these things. So know that just because a clinician doesn't bring it up doesn't mean that we aren't willing to talk about it and help you. So I have a few key takeaways, and then we'll go into a discussion and question and answers. So cervical cancer can have significant impacts on your sexuality and relationships. Give yourself time to rediscover and redefine yourself, as well as your intimate relationships, and talk to your clinicians. Please talk to your clinicians about this.